Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more important topic under cardiovascular system, that is jugular venous pressure or pulse. So I think you people are studying this from first year physiology, and in medicine there is nothing much extra. We have to learn what are the exact causes in the curves, what leads to that curve disturbance. So let's try to make JVP physiology class simple so that in further sessions we will try to look into what are the abnormalities you are going to see in the JVP curve. So what is actually JVP curve is? Jugular venous pulse is the oscillating top of height of venous blood in the internal jugular vein. Remember, it is internal jugular vein. Faithfully reflects the pressure and hemodynamic changes. Obviously, it is a vessel which has blood in it, so it signifies hemodynamical changes in the right side of heart in all phases of cardiac cycle. So main point you need to remember is it reflects right side of the heart in all phases of the cardiac cycle. So what is the significance of this is two main objective of examining the JVP are estimation of jugular venous pressure, as I said, and study of the waveform. These two important part under JVP hook you need to know it. It is a 5 marker and the abnormalities are separately 3 marker, and very important topic even for your PYQs. Jugular venous pressure is expressed as the vertical distance in centimeter between the top of venous column and the sternal angle regardless of the body position. So it is a vertical distance between top of venous column and the sternal angle. Okay. Normally it should be less than 3. It should be less than 3. If it is going above 3, it is abnormal. By convention, jugular venous pressure is measured by from the sternal angle with the patient reclining at the 45 degree. For our better convenience, we are taking patient in the 45 degree angle. Central venous pressure can accurately estimated from jugular venous pressure. So this is very important because measuring this gives accurate value of the central venous pressure. For this, sternal angle is taken is as the reference point. The center of right atrium lies 5 cm below the sternal angle regardless the body pressure. This is just an introduction part. If you want, you can just brush up, or if you want, you can just skip to normally to the curve part. This is just like I thought I can give an introduction part to the people who just don't know what actually JVP is and how it is measured, because in your final practical they will ask sometime when you take a CVS case, you need to know how you are going to measure JVP. They'll ask how you are going to measure JVP, show us how you are going to see and all. So I thought I can bit brief on the practical part also. The CVP is calculated as 5 plus jugular venous pressure. So it should be 5 plus JVP. So normally maximum it can be 8 in the normal condition, because less than 3 it should be. If you're taking maximal 3 as a JVP, it should not cross above the 8, right? So example, just take jugular venous pressure 6. So it will be 11 centimeter of the blood. In other words, jugular venous pressure reflects the central venous pressure and also the right mean arterial pressure, because it is directly entering the artery. I mean atria. Sorry, artery, not atria. Normal wave patterns of jugular venous pressure or pulse. The various waves of JVP reflects the phasic pressure changes in the right atrium. Normal JVP has 3 positive waves, namely ACV, and 2 negative X and Y descent. In normal person, A wave is more visible than the V wave, and the X descent is more prominent than the Y descent. So A is more prominent than V wave, and X is more descent prominent than Y wave. You need to remember. So we have ACV, XY. Okay. So let's see the important point why we are studying JVP. You need to know the curve very detailedly. It's not our detail. You need to know what exactly that curve signifies. So let's see that. A wave, it signifies atrial contraction. So we will start with the atrial contraction. So here it starts. This part it will start atrial contraction, specifically right atria. occurs just before the first heart sound and before the onset of ventricular ejection. Don't dig so, don't scratch your head so much. Just remember A, atrial contraction, specifically right atria. Then coming to C, due to bulging of tricuspid valve into right atrium. So A is contracting and that this atria is contracting and there will be some pressure on the tricuspid valve. So that is your C wave. Impact the adjacent carotid artery during ventricle systole. I'm trying to put more things because if you're interested in this part, you can just see everything. If you don't want, you want the exam point of view, just see this part only. Due to bulging of tricuspid valve in the right atrium is sufficient for your final exams. Then coming to V wave, due to passive right atrial filling during ventricular systole. So this has been closed and bulged and blood has been entered already, and this is going to push the blood into pulmonary circulation, whereas there will be passive filling. This is pushing here and the blood is filling in the atria. That signifies V wave. X descent, it signifies atrial relaxation, downward displacement of tricuspid valve during systole. This point you need to remember for your final exams. And additional point occurs during systole and ends just prior to second heart. So this is your PYQ. Y descent diastolic collapse, we say this is due to opening of tricuspid valve and rapid flow of blood into right ventricle. And your PYQ occurs after second heart sound. So I'll say quickly. A is A, atrial contraction, specifically right atria. C is related to bulging of tricuspid valve into the right atrium. V is related to due to passive right atrial filling during ventricular systole. X descent, also called as systolic collapse, due to relaxation of atria and downward displacement of tricuspid valve during systole. And Y descent, it is also called as diastolic collapse, due to opening of tricuspid valve and rapid flow of blood into right ventricle. I hope that is clear. If there is any doubt, you can just go back and start the video wherever you have the doubt. Important topic, you just need to focus this part. You can't skip the JVP curve. Then coming to abnormalities, this is like just a briefing. There is another session where I'll be saying individual curve details, why it is going to happen like that. So don't miss out that video, okay? Abnormalities in jugular venous pressure, mainly you need to know when there is something normal, you need to know why it is increasing, and your examiners are very interested in why JVP is raised in your final practical. So let's know some 2 to 3 you can remember. If you want, you can remember extra so that you can impress your examiner, and you need to know why it is increased. So don't miss out my another session, okay? Cause of raised JVP is right heart failure, then tricuspid regurgitation, stenosis, pulmonary embolism, overuse of IV fluids, constrictive pericarditis, cardiac tamponade, superior vena cava obstruction, acute nephritis, massive ascites, or right-sided pleural effusion. So after knowing these all causes, main point you need to remember is it is completely affecting the right portion of your heart. So it may be atria or ventricle, mainly related to right, since JVP is reflecting your right atrium. So I hope that was clear, and if you want, you can take a snapshot of this part, or this is what you actually need to learn in this video. And don't miss out the abnormalities video based on this JVP curve.